Hello, I'm Colleen Gallagher, CEO at Onward and Upward, and you're listening to the Association Insights podcast, where each week we interview association leaders from across the country to hear how they're trying new things, taking big risks, and delivering value for their members. We'll explore the realities of what it means to work in and with associations and bring you the insights and inspiration you need to advance your career and make big changes at your association. Let's get started. Welcome back to the Association Insights podcast. I'm your host, Colleen Gallagher, and if you've been tuning in as part of the Association 100 audience, you're in the right place. Same great content, fresh new name. We're still bringing you expert perspectives, actionable takeaways, and dynamic conversations to help you elevate your association's comms, advocacy, and leadership strategies. We're continuing our February advocacy series today and really excited for our guest, Louise St. Germain, the Director of Membership, Marketing, and External Relations for the International Society on Thrombosis and Haemostasis. Louise is a strategic leader with over 24 years of experience in membership, marketing, and external relations, including 12 years at ISTH. Her career spans the nonprofit and healthcare sectors, with key roles at the American Red Cross as a spokesperson and at Fleischmann Hillard International Communications, where she specialized in healthcare and clinical trials. With a deep understanding of the evolving healthcare landscape and the global geopolitical environment, Louise has built and led a dynamic team dedicated to advancing life-saving research, driving impactful awareness campaigns, and expanding global conversations on thrombosis and hemostasis. She's passionate about collaboration, innovation, and advocacy, ensuring that critical scientific knowledge reaches the right audiences to improve patient outcomes worldwide. We know she'll leave all our listeners with some really great insights today. So, Louise, thank you so much for joining us in the podcast today.
Thank you. Thank you so much for having me.
Absolutely. And you guys put me to a challenge here with pronouncing all the words correctly in your association name here.
You did a great job.
All right. Can you share more about your journey into association management and what led to this current role, how you got here?
No, that's a great question. When I started my career years ago, just a couple years ago, when I started my career, I never even really knew association management was a thing. When I started out, it was really communications, public relations, understanding how we communicate with each other, and really went to college at the University of North Carolina at Charlotte and really came out of there wanting to do media, wanted to do public relations, those kinds of areas, and dabbled in a little radio, a little television, and then really found my footing in communications, public relations, and media. But it's interesting, starting out at the American Red Cross, especially around the hurricane seasons of Hurricane Katrina, that's when I was there.
Wow.
And so that really taught me at a young age, in my 20s, how important being flexible, resourceful, understanding that environments are changing constantly. All of those things came together for me. And so that position really helped to shape my understanding of nonprofit, my understanding of the importance of the message and storytelling. It really brought me through my entire career. It taught me some of those. I think one of the most important things I can remember, I was at the Coliseum in Charlotte, and we had all these folks coming in on planes overnight from Hurricane Katrina. And we had to create an information room, and we had to collaborate with Goodwill and Salvation Army and local response teams. And it really taught me at that impressionable age just how important it is to be surrounded by partners, by having relationships, by building connections with people, because nothing happens alone. And so I say that because I was 23, 24. I don't even remember how old I was at that time. But those lessons brought me through the last 20 years, because that's where it all starts, is with people, building relationships and having connections. And that has brought me to coming to the ISTH. I started 12 years ago. I've been with the ISTH. I can't believe it, but 12 years, and really have had the opportunity, thanks to our amazing executive director, Tom Reiser, to build the first ever marketing program, the professional marketing program of the society, but also really build a team. We started with one, we now have 7 in the team, and a really comprehensive strategy for external relations as a whole. And so going through that journey over the last 12 years and understanding associations, it's really been exciting.
Yeah, what an impactful way to start your career for sure.
And then the thing that really stood out for me was you talked about the relationships and partnerships and how important they are. And I think that's so interesting in the association world because that's what associations do for their members, but it's also so key for associations to remember that's how they can have a bigger impact too.
Absolutely. Absolutely. Because I think a lot of organizations, especially nonprofit sector, you have very limited budget. And so because your budgets, I remember one year, I think my budget was $3,000 for the entire year. What do you do
Sounds
with
right.
that? Like
Yeah.
you, so the way to really push forward, you can't buy an agency. You can't do this, you can't do that, but you can be really creative, right? And you can really think outside of the box. And so I think that's so important. And those relationships that you build outside, they have a little bit of budget. They might have a little bit of budget. You bring it all together, you have more of a budget and then you can do more and the message goes further. And so I think that nonprofit background coupled with working at Fleischman Hillard for a couple of years really gave me that chance to say, I've seen budgets. I've also seen no budgets.
Right.
How can we do this? How can we make this work? And then continually innovating because if you're not innovating, you're stagnant and you lose the connections that are so important.
Oh my gosh, yeah. And associations, even with the smallest budgets, have done some of the most creative things. And I love seeing that. I love that. I just
It's important.
Let's talk external affairs. How do you really define that within an association, and why is it so crucial for bridging advocacy and public awareness?
I think they absolutely have to go hand in hand. I'm going to use a medical term, but really external affairs and external relations is that connective tissue between the mission statement and the work that we're doing and then what we want to impact. It's what connects us. You can't have one, I don't believe, you can't have one without the other. So you truly have to have that understanding of what makes people tick, what speaks to people, what narrative, how do we want to communicate and really understanding. I like to say you have to meet people where they are, not expect them to meet you where you are. You have to meet them where they are. And so understanding, bringing in that empathy, bringing in all those aspects all comes together. So you have that awareness, you have the mission, and you understand the impact that you want to make.
Yeah, that's so powerful, and it especially today, people expect to have information delivered to them where they are, and not just the channels they are, but where they're at in their terms of thinking. You need to, like you said, meet them there. And
Mhm.
communicators, we don't always like that. We want to say, this is the messaging and this is what we want to tell you, but that doesn't work.
No, not always, and I think you have to learn that, and maybe it's through life, right? Through life, you meet different people, you understand where they're coming from, but I'll tell you, at the International Society on Thrombosis and Haemostasis, it has given us the opportunity to understand and talk to people globally, not just in the United States. I think often being in the US, you're very isolated. It's the US effect, right? And so when you're truly global, you have to think truly global. Our members and audiences in Asia Pacific are thinking and dealing in different environments than they are in the EU versus South and Latin America. We're constantly having to think through how policies affect people globally, not just where we sit. And I think that's important. And that allows us to really be, I always tell people I'm like a resident of the world because you have to understand and really learn culture and learn people, regardless of where they are, and meet them where they are, if that makes
It
sense.
doesn't. And that's such a good perspective. And I can tell why you're successful because of this approach you take to it. I love that. So you talked about partnership, and the ISTH has had some really significant ones. I saw World Health Organization, the European Thrombosis Hemostasis Alliance. So talk to me about these efforts. How do they help you with advocacy and amplifying your own efforts?
Yeah, no, partnerships, like I said, and nothing happens alone. So partnerships are really force multipliers. So when I say a force multiplier, what I mean is it really truly extends the work that we're doing. So each partner extends the work that we're doing, extends our message, gets closer to an end goal or further down the field. And so that's so important. So collaboration with the World Health Organization, the ISTH, is a official non-state actor of the World Health Organization. And what that means is we have the opportunity to really work with them. We work directly with their global patient safety advocacy unit and quality care. And it's an opportunity for us to hear what's happening globally, find ways to participate with them and really share key public health messages, which is important. We also, so the ISTH several years ago also helped to establish the European Thrombosis and Haemostasis Alliance, which is primarily in the EU. All of our alliance members are thrombosis and hemostasis organizations, primarily in the European Union. And we're able to really stay informed. We work a lot with partners throughout the EU, but also in Brussels, specifically with MEPs, so members of the European Union and European Parliament. And that gives us an opportunity to hear what are the main objectives, whether it's the cancer mission or cardiovascular health, or even during COVID. This was very important to be able to have these conversations about what's happening there. And in our area of work there was very key during COVID-19. And so a lot of our amazing members of the society were participating in panels, guidelines, communication, and it really helped build that credibility, transparency across the pond, if you will, because we were able to have some of those conversations. Real quick, too, the other thing that's really important is working with regulatory bodies. So we not only work, obviously, in the United States with FDA, but the MA, which is the European Medical Agency in Europe, and working with them too about regulatory, the work that's going on, guidelines, guidance, hugely important. So those partnerships, whether they're within governments, with ministries of health, or at that global level, whether it's WHO or the United Nations and the work they're doing around universal healthcare, it's important for us to have our voice there. Our partners are there. And so us coming together to share important messages is key.
Yep. Oh, no, I love all of that. And thinking about associations, I worked in associations the whole beginning of my career before coming over to the agency side. And one thing we're not known for is coming out of our silos. So tell me about the strategies that you found effective when you're aligning those marketing, membership, and public affairs efforts to really elevate your influence, because that's a lot of moving pieces to bring all together.
No, you're absolutely right. And I think one thing we talk a lot about, especially with the directors at the ISTH, we have a lot of conversations, is bringing people along on the journey. You can't just say, hey, we're going to do this meeting, we're going to do this education initiative, and we're going to ask our staff to move in that direction. But we have to actually bring people along on the journey. So we're bringing our members along on the journey. We're bringing our staff along on that journey. And that's key because their buy-in, but also their voice, their ideas, all of those things, I think help us when we're working within those areas. I would say marketing and membership and external relations, they have a common theme of messaging and communication and transparency and making sure that message comes throughout all of those avenues and what we do. And then also making sure we're breaking down those silos within our programs at the ISTH. So education and meetings and publications, making sure we're all singing from the same sheet, if you will, is really key. And bringing people along on that journey because it's okay for it to change. It's okay to pivot when we need to, especially following COVID. But how we do that matters. And I think it helps us become stronger overall.
Yeah, the bringing people along on the journey is a great way to think about it, and I feel like associations can all that are struggling with this can take that and help get that buy-in. And I always think too, it starts from the top down. So when the leaders are
Absolutely.
open and involving everyone and in decisions and transparent, it makes the teams a lot more likely to work together too.
Absolutely. And I think our executive director, Tom Reiser, has done a phenomenal job. He's been with the society now, I believe, more than 13 years
So
and always makes it a point to bring directors in, bring outside agencies in to talk about what's happening right now. What does that environment look like so that we can be nimble and flexible? And sometimes we do change things up, and that's okay. And I think you learn more from those moments than you do when everything is perfect.
always.
And so you learn a lot more from it, but you're also able to go much further. And so you know that you're making an impact when you hear honestly from our members, which are healthcare professionals, but also our patients. The patient community, hearing from them is huge. And that's what gives me my purpose and what I do.
I love that so much, and it's so funny because when I worked at associations, we always joked, "We're not curing cancer or anything," and it's your members are doing their best,
Right.
so it brings a whole new level of meaning, which is really cool. And
It absolutely does.
and on that note, I wanna talk about World Thrombosis Day and that campaign. It sounded like such an incredible initiative and would love to know what went into it, and then after that piece, how can what can associations take away if they want to launch their own global awareness campaign? Is this doable for other associations too?
Absolutely. So, in terms of World Thrombosis Day, I have to say it's like when you have a child. It's now 12 years old and
Well,
we're in middle school and I was there from the beginning, which was really exciting. A year before we launched World Thrombosis Day, I can remember sitting in the room and having these important conversations about what if we had this world. And I will say that this is the most exciting project. It's almost a humanitarian project in a way. And it's really our arm with our organization doesn't have a patient component in terms of membership. And this was our opportunity to hear and work and talk with patients globally around the world and hear stories. And after 12 years, we get messages on Facebook, we get messages on social because of your campaign. I remembered to do this, or I was able to help my mom know that she needed to go to the doctor. It saved her life. Getting those messages are so important. And I would say that for our entire team, World Thrombosis Day truly has been that project that has brought us all together and we're able to share such dynamic stories and bring organizations globally around the world together. We have some phenomenal partner organizations like American Heart and World Stroke and World Heart and ASH and all of these different groups and all these different acronyms, but really and hospitals around the world and governments to really have important conversations and shine a spotlight on a condition. The facts are that 1 in 4 people globally each year die of conditions related to a blood clot. That's huge, 1 in 4. And chances are somebody, I know multiple people. And being able to talk about this and the risk factors, and if you're going to the hospital to ask for an assessment, is so important. And to hear, to see over the last 12 years too, that that impact has made a difference. It has been amazing. So, absolutely, to associations, if you have a thought around an awareness day, or if you see somebody else's awareness day and it's important to your mission, work with them. You don't have to start something from scratch. You don't have to recreate the wheel. You can reach out and say, how can I help your awareness day? How can we do this together? Because I know World Thrombosis Day is right between World Heart Day and World Stroke Day. And I call it a cardiovascular conversation because we're doing that now for 2 months, 3 months when you elevate it that way and you work with others on their awareness days and you go further, I think. And honestly, if your end goal is to build awareness, that's the best way to do it is with others.
that's such valuable advice. And I love the thought behind you don't have to start something brand new. Look what's there. Look, that's always a great
Ex-
place to start is assess what's there and then make the decisions based on that.
Mhm.
So
Yeah, absolutely. Because the other thing is there's so many days. Every day there's 16 days. And even World Thrombosis Day is WWTD is like also World Teacher Day, right? It's WTD. And it's also there's a World Toilet Day and there's all these days. So there are so many days. And that's why also it's nice to collaborate with others around their days. There's also a World Hemophilia Day, the World Federation of Hemophilia has each year too, and we support them with that day. So important. So definitely an important message to share.
yes, absolutely. So we're really focused this month on advocacy and how we can talk about that and shape those conversations. Last week, we talked to a lobbyist and how their lobbying firm is approaching things. But I'd love to know when you're thinking about advocating for change in healthcare policy, how does the ISTH engage with regulatory bodies, with policymakers? What are you doing to really support your end game and your initiatives?
Yeah. So again, I'm going to use a buzzword here, multi-prong approach, right? So definitely have to take an approach that leverages scientific evidence with expert voices, which are our members and patient stories and patient advocacy. So it's that secret sauce, if you will, that allows us to engage early and often with regulatory bodies like FDA and EMA and align with broader public health priorities because like we have to break down those silos. So aligning with those public health priorities, those conditions. Yes, we are in thrombosis and hemostasis, but thrombosis and hemostasis touches so many other conditions, cancer, oncology, cardiovascular, heart, stroke, nephrology, radiology, nursing, like all these different areas we touch. And so it's important to be clear about the various public health priorities not just in the US, but truly global for us.
Yeah, that makes so sense in thinking that global perspective. You all have a lot on your plate, obviously, and another big thing for associations is looking at the crisis comms side of it. And drawing from your experience, how can organizations prepare for and navigate these crises while also maintaining public trust? Because that trust is a huge part of being able to be successful in these advocacy efforts, especially when you're not just in one area, you're everywhere across the globe, and you need to have that trust worldwide.
You're absolutely right. I think I'm very fortunate for my early experience, but I will say when I started in associations, I felt like people were really scared of the what ifs. And so because there was a lot of fear, there wasn't always a lot of planning. It was, if we look the other way, it probably won't happen. So let's not really have those conversations. So it was almost like a duck and cover situation. And so I brought a perspective that let's talk about it. It's not easy and it's hard, and you don't want to bring up the what ifs. You don't want to speak it into the world. But if you don't prepare and bring people along on that journey of preparedness, then you're going to fall short when things happen. I remember at the Red Cross, we were talking about bird flu years and years ago,
Wow.
and now that conversation is back.
Yeah.
And so if we hadn't had those conversations all those years ago, I think would be even more difficult now. And bringing people along in that communication, I think crisis communication is so important for associations. We cannot have an old mindset or an ancient mindset of let's prepare for one or two things. Now, in the world we live in, we have to prepare for everything. So, having a clear communication response plan, a crisis communication response plan, making sure that it's open. The other thing that I always say is it has to be a living, breathing document. Don't put it on the shelf. Don't put it on your Google Drive and never look at it
Yes.
again. You have to revisit it because we see in the news every single day something new is happening. And so if we're not thinking about it and bringing your teams along in the conversation, then I don't think you're truly prepared for it when it happens. And I think honestly that helped us as with the pandemic when it started and we were all of a sudden everybody's remote and working. It helped us to say, okay, we've talked about this before. Maybe not this exact thing, but we've talked about this before. This is what we're going to do. And this is how we're going to talk to our members. And we really quickly brought together organizations to sign a contingency statement about COVID starting out in the beginning and about some of those key components. And it was more than 100 organizations signed on to that. But we quickly did that within just a few weeks. And I think being able to say, hey, we've talked about this. And maybe not the exact situation, but we know what we want to do and we know we want to be transparent. We know we want to talk to people and have open communication and we want to bring people on the journey with us. It might not be easy, but as long as we're working together and communicating about it, we're going to get through it together.
And you can tell the organizations that it's not just something they did once 10 years ago, put on a shelf and pull it off, because you can see when someone's ready, when they respond authentically and
Mhm.
rise to the occasion to address the situation. It's very clear that they are talking about this. They know how, like, that it could happen and they're ready to address it.
No, you're absolutely right. I think the other thing is we talk a lot about the making of like leaders, right? And managers, leaders. And the word we always use is it's so important to have empathy, but an organization has to have empathy too.
Yes.
And when they communicate, communicating with that respect of the audience and that empathy and understanding, again, meeting people where they are and how we communicate with them, I think is absolutely essential. And I'm proud of the ISTH and how we do that and how our leadership does it and how our members do that and our staff. It's really, truly remarkable. And I think being able to do that well is hard, but we have to continually take that pulse about how we're interacting with people.
Yeah. Amen to that. I love that. So now the $1,000,000 question: with the recent changes in the US administration, how are you adapting your advocacy strategies to effectively engage with new policymakers and really, especially in the healthcare landscape? What are you doing differently?
Yeah, this is definitely a hot button topic right now. I know. The great thing about the International Society on Thrombosis and Haemostasis is that we are a truly global organization and we work hard to stay agile. We're constantly monitoring policy shifts and it's happening globally, not just in the US. We're not just in the US bubble. We're really looking at this in the EU, in Asia Pacific, in South and Latin America, all these places, in Canada, all these places, we're looking and having these conversations. By positioning the ISTH as nonpartisan, evidence-based, all super important, and really making sure our messaging is aligning with the evolving healthcare priorities and communicating with the different agencies wherever they may be, whether it's the Ministry of Health somewhere or if it's like CDC or other organizations around the world. So making sure our messaging is aligning. Advocacy isn't static. I always say that. I think that's important to say, that it requires ongoing dialogue, constant communication, and education about what's happening. And I think we just have to continue to work to align our mission with what we're doing and how we're working with people. I think that's truly key. And as we do that in different places around the world, that's what we're really focused on.
That's a great outlook, and I think a great way to approach the world today. So I love that. Can you talk to me about a specific public awareness campaign you're really proud of, or you think really helped achieve your organization's goals that you could share with our listeners?
Yeah, I know we talked about World Thrombosis Day. I always go back to World Thrombosis Day because I do think that that's been a very successful public awareness campaign. It's won 14 awards in different arenas, and we worked really hard to really increase awareness of blood clot risk and influence healthcare policies globally through that campaign. I think, and it's in the evidence too, has really driven real world change from encouraging hospitals and hospital systems to use VT risk assessment models and really educating patients about their signs, symptoms, risk factors, evidence-based out prevention, and then also life after a diagnosis. It's so important. So I would definitely say World Thrombosis Day would be one of my favorites. It has a personal connection for me. I lost my father to a massive heart attack when he was in his 40s, and I was a child, and obviously had a huge impact on my life. And I always say, if I can prevent somebody from losing a parent, then I've done my job in life. And so that campaign is truly what I'll always go to as an important example of the work that the society is doing, at least with that campaign.
Wow. I'm so sorry to hear that, but I can also see the passion it then brings for you to your job. And that's really clear and really rings through.
Absolutely. Thank you.
Yeah. So crystal ball time. What are the big trends we're seeing in advocacy and public affairs, and how do associations stay relevant and get ready for them?
Yeah, again, it's going and talking to people. And I always think it's important to take time, especially in the association space. We spend a lot of time talking to each other, but reaching out and talking to other people. So whether you're part of a chamber or different groups or a business networking group, talk to people and really have these conversations with them about, hey, what's going on in your area and understanding how they're approaching different things. So what I would say, three main areas. Um, One is absolutely the future of public awareness, communication, probably every area of society is AI and digital strategy. We have got to be on the cusp of that. And I think in the beginning, a lot of people were like, oh no, it could take my job. No, absolutely not. If you really understand how to strategize and utilize it. Think smarter, not harder. And so that's what I'm always telling my team. I'm always talking with them about how can we think smarter and not harder? How can we utilize a tool in our toolbox that is phenomenal? It's changing. It's a little scary, but how can we utilize it, harness it, and use it for good? And how can we use it as part of our strategy? How do we strategize around it? I think that is absolutely one of the most important things that any association, any organization should be doing right now, having those conversations. I think the other two areas is really personalized engagement. How are we engaging with people? The days of social media is constantly changing. What platforms are we on? But how are we changing up our messages per platform for our audiences? Because not all the same audiences are on every platform. So how do we diversify our message while saying similar things, right? So that's tough, but based with on our stakeholders, really speaking with people in those different ways, I think that personalized engagement is key. And we have to continue to do that in order to build relationships and continue to grow membership because memberships can be in decline sometimes. And it's hard to keep those numbers going. And what are the benefits? Having those conversations, but we have to personalize it Every person that's a member is a vital, important part of our society, and letting them know that at every touch point is essential, is essential. I think the last thing real quick is really just that cross-sector collaboration. We talked about this in the beginning about partnerships, collaborations. It's not just a buzzword. Who are you talking with? If I'm the director of marketing, I'm going to call the director of marketing at another organization and say, how's it going for you? What are your challenges? We learn more from each other than we do sitting alone in a cubicle or at home, working from home. We learn more from each other. So stay social
Yeah.
and reach out to groups like ASAE and other partners that have this wealth of information. It's so easy to sit, especially when things are stressful, sit and shelter in place. But it's really important to reach out and talk to somebody.
Oh my gosh, yes, and all 3 of those pieces are so important. I feel like this answer alone is worth the listen for our audience. The personalization piece speaks to me so much because we talk about that a lot, but you don't usually hear people articulate what it means. It's and in my world of PR, a lot of people default to the, "I do the high first name," and I'm like, "No," like, putting someone's name in an email, just not personalized communication, so all of that is so
No,
good and really impactful and important.
it's important to just as human beings. If you're working with members or they're your leadership, if they have children, ask about their
Right?
kids. If they are going on a vacation, it's okay to say, how was your vacation? Again, I talked about empathy. I talked about that personal experience. That is important. And we've lost a lot of that, I think, through lots of technology, but you can still find ways. It just takes different effort,
Yeah.
not more effort, different effort. And finding that and understanding that and connecting with people, I think is only going to make us stronger, especially when we're working globally. We have to do that.
This has been amazing. I've loved every piece of this conversation. But before we let you go, we like to wrap up all of our podcasts with a little just for fun section so our listeners can get to know you a little bit. So, first question is, have you gotten to get away to anywhere fun lately?
I think I would definitely say last year, our Congress, our yearly Congress was in Thailand.
Ooh.
So we were in Bangkok, Thailand. And after that meeting, I took some time to go to an island. I'd never been to Thailand before. I'd never been to that part of the country and had a really beautiful vacation for a couple days after the meeting. Absolutely breathtaking. Amazing culture there. I absolutely love Thailand. I definitely will go back one day, but that was extraordinary.
Oh, that sounds fantastic. That's on my bucket list for sure. Okay, so we obviously love podcasts here. Are you a podcast listener? And if yes, is there any ones you listen to you'd recommend for our audience?
Oh, wow. So I do listen to some. I'm really into entertainment podcasts. I would say, um, I do listen the Mel is it Mel Robbins right
Yes.
now, the Let Them theory. So I have been actually I have the book right here with me, the Let Them Principle, because I'm reading this and I think it's really important because sometimes things don't go our way and we have to think through how do we just let people move in the directions they want to move in and focus on what you can control? And I think in today's day and age, especially in the environment we're in, we have to sometimes focus on what we can control. And I would say Mel Robbins definitely is a highlight right now for me.
That's awesome. It's funny. I haven't listened to her podcast yet, but I listened to Katie Couric's and Katie had her on. And so now I have
Yes,
that book on my to read list because
definitely.
the way she talked about it, I was like, oh, this is good philosophy.
It resonates when it's straightforward. It's also a thin book. So I
I
am
like
here for
that.
that.
Yes.
Me too.
All right. What's one place in the US you've never been but are dying to go?
I absolutely would say Montana. I'm a Montana, Wyoming. I want to go out west. I want to go to a ranch. I want to ride horses. I want to do that. I've been to a lot of different places around the world and in the US, but I've never been there.
That would
So
be very
I would
cool.
love to go there. Yeah.
Awesome. Awesome. Okay. Last one. Finish this sentence. When you see me looking at my phone, it probably means that I'm.
Probably looking at pictures of my dogs.
I love it.
I have two German short hair pointer dogs and they're very active. They love to be seen. They're like little people. And so we go out in the woods every day. We do a lot of activities. So I would say definitely looking at pictures of my dogs.
Amazing. That's fantastic. Louise, thank you again so much for sharing your time and your insights with us and our listeners today. This was such a valuable conversation, and I really appreciate it.
That's a wrap for today's episode. The Association Insights Podcast, previously known as the Association 100 Podcast, is a production of Onward and Upward Marketing and Communications, where our mission is to make associations and nonprofits the go-to source in their industries through earned media and thought leadership. This podcast is an extension of our newsletter, a bi-monthly collection of best practices, top trends, helpful ideas, and smart strategies delivered straight to your inbox. Have you undertaken a big change at your association? Or do you have some words of wisdom from the trenches of association life? We want to hear from you, and so do our listeners. Drop us a note at info@onwardupward.com. That's info@onwardupward.com. Be sure to subscribe, give us a 5-star review, and share with your friends and colleagues. We're available anywhere podcasts are found. Come back next week for more association insights and inspiration. Thanks for tuning in.